All right, of course, it's not streaming to YouTube. Oh, actually. Actually, is it streaming to YouTube? I think it might be. All right, let me share my screen. Oh. All right, I think we're recording. All right, well, thanks for joining me on this Saturday. Sorry for the delay. And just been a crazy the last 25 minutes at about, so it's 1:05 my time. And just, I'm at my regular office right now. I was planning to do this from my home office. And then about 12:40, we lost internet, both wireless and connected. I have the Ethernet cable, so it was actually connected through the Ethernet. And I wasn't sure what was going on, so I just rebooted, just knowing that the call was only a few minutes away. I rebooted and rebooted the server, the yeah, and the modem, whatever you call it, just um, and anyway, so it didn't come back on. So I was like, I just had like 12 minutes to get to the office and get my computer. And, so it turned out as I was driving out of our development that the cable spectrum in our case was there. And so they probably did something. So anyway, so just got here at the office at like 12:59, but still had to log into Zoom. And then not sure if I don't think it's live streaming to Facebook. I'm sorry, to YouTube. Yeah, just been a real bad week with technology. Um, and I feel bad because the other day I tried to live stream to actually it is showing some of it showing that I'm live on YouTube, but when I go on YouTube, I can't see. All right, if anybody's on YouTube, definitely feel free to put a comment in to let me know that you're seeing this, because in my YouTube studio, it looks like it's being recorded to YouTube, but then on another window, it's saying that the video is unavailable. So, all right, well, yeah, anyway, so Wednesday night I did one of these calls and I tried live streaming to Facebook and was unable to do so. And I've done this in the past. I can't say I'm an expert, but it's not like it was the very first time. And so some issues, I guess, with Zoom to Facebook. And then I did YouTube a few weeks ago, I guess it was, and didn't have a problem. So unfortunately don't have time to troubleshoot really. But Elizabeth says, thanks for adapting. Always have a backup. Yeah, well, I have a backup office, so that was my backup. But so a couple of things. I'll probably, after I do the presentation, I'm gonna have to take a very brief restroom break just because I had my smoothie around 11:30, and usually right before this I would go to the restroom. But again, I was too busy panicking and rushing out. So I'm going to give the presentation, take like a 2-minute break, which will give some time for questions to come in. And yeah, unfortunately, I forgot to grab my water bottle as well. So hopefully all goes well with that. But anyway, so again, apologize for the delay. And, those watching the YouTube recording, because again, I don't think there are people live on YouTube. But again, I apologize when you see this. Again, it's just not sure what's going on with YouTube. Yeah. So, but anyway, let's go ahead and get rolling. It is what it is. And all right. So before we start, so it's thyroid. So again, we're going to be talking about Thyroid Triggers 101. It's going to be a brief presentation. Many of you know I'm doing a challenge, the 5-day Accelerated Thyroid Healing Challenge that starts on Monday. So this is kind of like a pre-challenge training, although you don't have to be part of the challenge. So it's, if you didn't enroll in the challenge, that's fine. But also, while we're rolling, feel free to let me know where you're Zooming from. And and I'm in Matthews, North Carolina, which is right outside of Charlotte, North Carolina. But so this Monday, May 17th, we're having a free 5-day Accelerated Thyroid Healing Challenge. And so the way it works, we've had questions. Do you need to be on Facebook? You do not need to be on Facebook. So every day there will be a 10 to 20 minute pre-recorded lesson and assignment emailed to you. You do need to register for the challenge to get those emails. So if you're on my email list but haven't registered for the challenge, you won't be getting the email. So just because we don't want to send it, we've been sending emails letting people know about the challenge, and but we don't want to every day send it to people who don't want the information related to the challenge. So again, a brief pre-recorded lesson every day, 10 to 20 minutes, just really trying to get straight to the point and want to make sure it gets consumed and not spend an hour putting together these presentations. And then, so live calls on Zoom. So it was supposed to be Zoom live stream into the Facebook group, but it looks like it's just going to be on Zoom. And then I was thinking, well, maybe Zoom and we'll just live stream into YouTube, but we probably won't do that because again, no success with that today going to YouTube. So probably will just be on Zoom and just record it. And then again, for those who are part of the challenge, we'll just, when we send out the emails each day, we'll have links to the recording. So I think that's probably how we'll do it. I had my very first challenge was right when the COVID stuff started in April of last year, April 2020. And we didn't do anything with Facebook at the time. Everything was on Zoom. So it's not like we need Facebook. So we'll rotate the times to accommodate those in different time zones. So again, just to summarize, every day, Monday through Friday, you'll get an email about 6 a.m. Eastern time with the pre-recorded lesson. And then there'll be the live calls on Zoom Monday through Thursday. There'll be a live call, kind of like with a presentation, kind of like we're doing here, presentation and then some Q&A. And then that next Friday, we'll be having 2 Q&A sessions. So it'll be just Q&A. So there will be prizes for participation. So this you will have to, if you want to be eligible for prizes, it is through the Facebook group, just because I don't know really how else to do it. I've been doing that, since last June. We had our next challenge. That's when I started doing Facebook. So again, you don't have to be a part of Facebook to get the content, just like you're not part of Facebook now. But if you want to, there's going to be a daily question, and to answer the question, it's going to be in the Facebook group, and that's where the engagement takes place. So if you're just in it for the content, you don't have to join the Facebook group. But if you want to, win prizes and engage with others, then definitely consider joining the Facebook group. If you haven't joined yet, you could do so by visiting this website, rapidthyroidhealing.com. And then again, the Facebook group, I have 2 Facebook groups. So this will be in the Graves' disease, Hashimoto's Facebook group. I also have a separate one for hyperthyroidism, but again, the action will just be taking place in this Facebook group, again, Graves' disease, Hashimoto's Facebook group. And all right, and that is it. So we're going to start off by talk about the triad of autoimmunity. So the triad of autoimmunity, there's three components necessary for autoimmunity to develop. And also, just to let you know, the challenge isn't just on Graves and Hashimoto's, but most people with thyroid conditions have Graves and Hashimoto's. So you could definitely benefit if you don't have an autoimmune thyroid condition, but there will be parts of the challenge, just like now, where we're talking about autoimmunity. So triad of autoimmunity again. So this applies to Graves and Hashimoto's. There is a genetic predisposition. Also exposure to one or more environmental triggers, and an increase in intestinal permeability, also known as a leaky gut. So according to this theory, you need these three components for autoimmunity to develop. The good news is, even though genetics are required, you could still get into remission. You could still reverse the autoimmune component by finding, removing triggers, and healing the gut. And then there's four main categories of triggers. So again, this doesn't mean that there's it's not all inclusive. There could be other triggers, but most of the triggers will fall under one of these four categories. So one is foods such as gluten, dairy, corn, stress, and it could be emotional stress. It could be physical stress. Chemicals. Of course, we live in a toxic world, so definitely we'll be talking more about this during the challenge. And then infections, certain infections. So it could be gut infections such as H. pylori. There's definitely in the literature a correlation, and I know correlation doesn't always mean causation, but from what I see, what I've seen in my practice and other practitioners I've seen, H. pylori, does seem to be a potential trigger in those with Graves and Hashimoto's. And there's viruses such as Epstein Barr. There's stealth infections such as Lyme disease. So let's go over these triggers one by one. Again, we're not going to spend too much time on this. And let's see. So again, gluten, I mentioned, dairy, corn. So sugar isn't really a trigger. Like, it's not, sugar itself isn't necessarily going to directly trigger an autoimmune response. These other three, there is research behind gluten, dairy, corn. So I haven't really seen anything with sugar, but of course we want to try to minimize our consumption of sugar, especially the refined foods and sugars, and it could lead to other problems such as a candida overgrowth, which in turn could cause a leaky gut, which could be a factor in autoimmunity, as I mentioned before when discussing a triad of autoimmunity. Now, salt, I do recommend sea salt to my patients, but you want to be careful because too much salt can be a factor with autoimmunity. There's been research that shows that salt increases Th17 cells, which are associated with autoimmunity. So you want to be very cautious about salt. And then food triggers versus food sensitivities. And what I mean by this is that, like you could be sensitive to food. It doesn't mean that it's necessarily a trigger. So like someone might be, have a allergy or sensitivity. Allergy is an immediate reaction, like within a few seconds to a few minutes. Food sensitivities could be a few days. Sometimes it's a few minutes or a few hours. But eggs, for example, you could have a sensitivity to eggs, but it doesn't mean that eggs is necessarily a trigger. Now, that being said, if you're reacting to it, it can cause symptoms. It can cause inflammation, and probably a good idea to avoid the food. And again, I'm pretty sure we'll be talking more about this during the challenge. And if not, there's, you could also, ask questions. That whole challenge, is really just about, teaching you, how to, again, accelerate your thyroid healing, but also to try to answer your most important questions. I can't guarantee I'll answer all questions. I should also mention, I didn't put on the slide, but when you sign up for the challenge, if you haven't signed up already, when you sign up, you'll receive a thank you page. And then on there'll be an option to join the Facebook group. There'll also be a VIP upgrade option. So I'm bringing this up just so there's no surprises. You don't have to join the VIP upgrade. It's $27 if you do decide that. But what that's where you get recordings of everything. Otherwise, you'll have access to the challenge information until May 23rd. which is a week from tomorrow. But the VIP, you get the recordings. There's an extra bonus Q&A session, and there's a few other bonuses. Or well, there's the Q&A session is a bonus, and then there's an extra master class. But you'll see that when you, I just forgot to mention it here. And if I waited until the end, I probably would have forgotten to mention it. So, and I'm bringing it up just because last time when I did the challenge, I did a different challenge in February. There are a few people who, or really one person in the Facebook group who was upset that I didn't warn people about the VIP. But again, it's an optional thing. Most people won't do the VIP, honestly, but a small percentage will. And all right, so food is one trigger. Stress is the second trigger I'm going to talk about. So our adrenals were designed to handle acute stress situations. So chronic stress, a big problem, especially in 2020 into 2021. So this year, maybe better. I mean, of course, every year is different, and different people have different stressors. Even well before 2020, there's always going to be stressors, and that's why we want to do everything we can to improve our stress handling skills. Make sure we're doing the basics, eating well, managing our stress, and getting sufficient sleep. So again, you won't be able to eliminate all of your stressors, and as a result, you need to work on improving stress handling skills. All right, so chemicals. So there are tens of thousands of chemicals in our environments. So heavy metals, for example, such as mercury, and xenoestrogens, such as bisphenol A or BPA, phthalates, glyphosate, which is the active ingredient in the herbicide Roundup, mycotoxins from molds. All right, and yeah, definitely don't forget about electronic pollution. So these could all potentially be triggers, and they might not all directly trigger autoimmunity, but like, for example, glyphosate, I don't know any evidence that shows that it directly could trigger Graves' or Hashimoto's, but it can cause intestinal dysbiosis. And most immune system cells are located in the gut. So intestinal dysbiosis means you have an imbalance of the gut flora. So that could definitely be a factor with autoimmunity. It's not to say glyphosate would be necessarily the main cause of Graves' or Hashimoto's, but could potentially be a contributing factor. All right, can there be more than one trigger? So it's common to have multiple triggers. So for example, someone might have gluten sensitivity and an infection. And direct triggers versus leaky gut triggers. So what I mean by this is, and I'd speak about this in my book, some of you might have read my book, Hashimoto's Triggers. So direct triggers, so gluten, for example, gluten could, at least according to the literature, can directly trigger autoimmunity. And some say it's like through a molecular mimicry mechanism where there's like a similar amino acid sequence, but either way, potentially can be a direct trigger, but then it also can cause a leaky gut, which is part of that triad autoimmunity. So even if gluten is not a direct trigger, it may cause a leaky gut, which could prevent you from healing. So if some people will say, well, I feel fine when I eat gluten, is it still a good idea to remove it? And yeah, I would say yes, it is a good idea to remove it. And all right, so apparently I left out the, all right, I didn't include the fourth trigger, which is infection. So infections, just to talk a little bit about infections. I did mention it before. So there's, not all infections will trigger Graves' and Hashimoto's. The latest infection, that we've been exposed, COVID, there is some evidence that it could. I know there's definitely evidence. I wrote an article in September 2020 where it could lead to like subacute thyroiditis, but it does seem like it might potentially be a potential trigger with Graves' Hashimoto's as well. So and that's not unique when it comes to viruses. Again, Epstein-Barr, there's evidence that Epstein-Barr could be a trigger, and most people have Epstein-Barr, so it doesn't mean that Epstein-Barr will be a trigger in everyone who has it, or and even everyone who has a genetic predisposition. It doesn't mean that they're going to develop, Graves, Hashimoto's, another autoimmune condition. But yeah, so there's, again, gut infections. I mentioned H. pylori. There's also one, Yersinia enterocolitica, in the research shows that that could be a factor with Graves and Hashimoto's. Parasites. Not a whole lot in the literature with parasites and Graves and Hashimoto's. There is some evidence with Blastocystis hominis being a trigger. And I've seen it in my practice, I've seen both with Graves, Hashimoto's. So even though it's not in the literature, doesn't mean that they can't be triggers, but I'm just saying that the research doesn't show really a correlation. So, all right, so how can you find your triggers? So, I mean, symptoms, usually not. There's just so much overlap that it's really difficult. I mean, if someone's eating gluten and they're getting symptoms, then again, either way, it's probably a good idea to avoid gluten. Infections, again, just it's still, if you're getting what H. pylori, for example, not everybody gets digestive symptoms. Some people do get heartburn, reflux, ulcer-like symptoms, but that's not the case with everybody. I've worked with a lot of people who don't get symptoms. So, if you have those symptoms, yeah, maybe you could, I wouldn't say conclude, but I would say it's best to test, which is one of the ways that I'm going to bring up here. So comprehensive health history. So that's what myself and most other healthcare practitioners do when they're working with someone one-on-one. And again, testing, I do like testing. It doesn't mean I go crazy with the testing, but I don't like guessing. And then conservative versus comprehensive testing. So when I dealt with Graves' disease back in 2008 is when I was diagnosed. So I had, I consider it basic testing, but some will consider it more advanced testing. So I had an adrenal saliva test, I had hair mineral analysis test, I had blood testing, and that was pretty much it. Where some people do need more comprehensive testing, such as a comprehensive stool panel, organic acids testing. And the downside of doing comprehensive testing right off the bat is that you might not need comprehensive testing, and you might be spending a lot of money you don't need to spend. The downside of conservative testing is while you're saving money, you might not get all the answers you need. So that being said, I mean, that's why I also do a comprehensive health history. If I think someone needs a comprehensive stool panel or, a small intestinal bacterial overgrowth test, then I'll recommend it. It's not like I'll just recommend adrenal testing and hair testing and blood testing to everybody, but that, for most people, I will recommend those tests. And some people, that's all they'll get. Other people, they'll get more testing. So are blood tests enough to find your triggers? I mean, it depends on the situation. Usually the answer is no, but like, again, Epstein-Barr, you could test for viruses in the blood like Epstein-Barr, and that could determine that Epstein-Barr is a trigger. But again, the thing to keep in mind with viruses is that we all have viruses in our body, and most of us have Epstein-Barr. So even if you have Epstein-Barr and if the levels are very high, it might be a trigger, but it doesn't always mean the goal is to treat Epstein-Barr directly. Sometimes that's the case, but sometimes, either way, you want to address other areas of your health, other areas of your body that might be dragging your immune system down. So like, for example, if someone has, again, if they have some type of gut infection and leaky gut, and they also have Epstein-Barr, you need a healthy gut to have a healthy immune system. So if all you do is take herbs or homeopathy to treat Epstein-Barr, but don't do anything to heal the gut and get rid of the gut infection, then you probably won't get into remission. So, and for those with non-autoimmune thyroid conditions, viruses can have a direct impact on the thyroid, certain chemicals such as mercury as well. So again, this isn't only applicable to those with autoimmune conditions. All right, so final reminder, join the Accelerated Thyroid Healing Challenge at rapidthyroidhealing.com. Again, it starts on Monday, goes Monday through Friday. Every day you'll get a pre-recorded message or a pre-recorded video, pre-recorded lesson, 10 to 20 minutes in duration. And then Monday through Thursday, I'll be going live on Zoom like I am now. I'll be rotating the time. So Monday, I'll be live at 12 noon. Tuesday, I'll be live at 8 p.m. Eastern time, Wednesday, 12 noon again, Thursday, 8 p.m. Eastern time, and then Friday, I'll have a 90-minute Q&A at 12 noon and another 90-minute Q&A at 9 p.m. So I would have liked to do it at 8 p.m., but I have actually an online conference I'll be attending. And that'll be from 5 to 9. So that's why I'm doing it 9 o'clock on Friday. And then if you upgrade to VIP, which again, that's optional, next Saturday, I'll be doing a bonus call with Q&A. And it'll be, it's actually advertised as a 90-minute like a bonus Q&A session, but there'll be also a little bit of teaching as well. And then the masterclass, the bonus masterclass, will be the first Saturday of June. All right, and that is it. So I am ready for questions, and there's a few questions. So I'm going to take a quick potty break. For those who might have trickled in late, I'm at my regular office here, but was planning to do this at home, and then I lost internet like 20 minutes or so before the presentation was before 1 o'clock my time. So I rebooted, the router, and that didn't help. But anyway, so long story short, I, usually empty my bladder right before these presentations, but didn't have an opportunity to do that. So, so again, I'm gonna put you on hold for 2 minutes. Type in your questions, and then as soon as I get back, I will go ahead and answer them. I'll go probably about 30 to 45 minutes. It depends on the question. So about 2:15 Eastern time. So I'll be right back. All right. Thank you for your patience. And all right, so let's see. So Nedra here, can you heal your thyroid if you've had radioactive iodine therapy already? Um, sorry, it's just giving messages. It's okay, never mind. I was getting something, a message in Zoom. All right, so to answer that question, sometimes, many times, no. I've written an article on that, so you might want to visit my website, naturalendocrinesolutions.com, and take a look at that. And I've written a few articles, but one, um, yeah. Anyway, a few on like natural treatments after radioactive iodine thyroid surgery. But it depends on also the dosage. Sometimes when someone receives radioactive iodine, they might actually need a second dose just because the doctor didn't use enough. And so in that case, then yes, and again, they might, yeah. So it really does depend on the person. But if someone sees me, I could never promise, like, that's most people who see me have not received radioactive iodine. There have been some people who see me and they ask me the same question. I'm like, well, either way, if someone has Graves' disease, my goal, honestly, in this case, wouldn't be to try to restore someone's thyroid health. It would be to try to restore their immune system health. And if we end up, getting to the place where their thyroid is functioning properly, great. But that's not my main goal. Same thing if someone had toxic multinodular goiter, received radioactive iodine, we'd still want to address the cause of the problem, and maybe they would be able to gain full or partial function of the thyroid, but that's not always the case. So like I said, I would never encourage someone to work with me for that purpose because it's completely unpredictable. Okay, so Janita, how does one find out if they have a leaky gut versus direct trigger? There's really not a good way to find out. Either way, you want to remove the trigger, whether it's a direct trigger or leaky gut trigger. Like, so for example, let's say if someone with Graves' disease has H. pylori. So H. pylori could be a direct trigger, but that also can cause a leaky gut. So we don't know, but either way, we'd want to get rid of the H. pylori in the situation. Same thing with gluten, so you really, yeah, there's not really a great way to distinguish, but either way, you'd want to address it. So Oriana asks, can you recommend some basic blood tests? So, thyroid related, definitely TSH, free T3, free T4, and then antibodies. So for the more common three main antibodies, TPO or thyroid peroxidase antibodies, anti-thyroid globulin antibodies, thyroid stimulating immunoglobulins. If someone's dealing more with hypothyroidism, Hashimoto's, and they probably don't have to do the last one, the TSI or thyroid stimulating immunoglobulins, even though it is possible that you could have it, but the truth is you could also have other autoantibodies and you can't really test for all of them. But and then, so vitamin D, I recommend 25 OH vitamin D for just about everybody. An iron panel, I recommend an iron panel for most people, not just cycling women, but for men and those in postmenopause, because someone could have absorption problems and they could have low iron. Some people have high iron and they don't know it also, so that's a concern. So I'll do serum iron, ferritin, iron saturation, and TIBC, which is total iron binding capacity. And let's see. So I like to look at CRP, HSCRP, which is high sensitivity C-reactive protein. B12, I look at B12. It's not the best marker. There's urinary methylmalonic acid is actually pretty good. But when people go to their doctors, a lot of doctors don't really know what that is, or some doctors don't know what it is. Some doctors know what it is, but they don't want to test for it. But that's the case with other markers as well. So, and then of course, like basics like CBC, complete blood count with differential, a comprehensive metabolic panel, lipid panel, so those are some of the ones that come in, but those would fall under like my basic blood test. least the ones that I'm thinking of. So. All right. So Melanie, I've been tested for EBV 10 years. So Epstein-Barr virus, 10 years when I was diagnosed with chronic fatigue syndrome and fibromyalgia. I've had activated chronic Epstein-Barr virus for years. So I need to test again. Is it necessary? Why? Basically, I need to keep my medical expenses as affordable as possible. I would say no. In your situation, I like to look at Epstein-Barr for like a baseline, but if we know that it could be causing problems, then again, the first thing is to try to correct other imbalances that's dragging down the immune system. And if that's not helping, then yeah, we might, we might, and I'll put people on an herbal, homeopathic protocol for Epstein-Barr. So it's not like I never do it. It really depends on the situation. So, yeah, so if yours is like activated chronic EBV is what you mentioned. So yeah, even though it's been years ago since you had that tested, I would assume it's still a problem. And, if you're having symptoms, I mean, I assume you're here because things aren't perfect, but yeah, so I would agree that, it's just, especially if you're on a budget, but even if someone's not on a budget, I wouldn't say it's absolutely necessary. All right, so Elizabeth, I've read that hyperthyroidism can bring on atrial fibrillation. Can Hashimoto's hypothyroidism also cause an AFib incident? I had one after thyroid meds were reduced by 1/3. So yeah, it is definitely more common with hyperthyroidism, but then, usually a lot of people get that increased resting heart rate due to the elevated thyroid hormone levels. So with Hashimoto's, thyroid meds, reducing thyroid meds, I wouldn't think it would cause atrial fibrillation. I would think the opposite if someone's on too high of a dose of thyroid medication, or there's also the condition Hashitoxicosis that some people with Hashimoto's have, where they have transient periods of hyperthyroidism. So that might be a concern. But yeah, if I'm understanding you correctly, and you had an atrial, AFib after your thyroid meds were reduced, that I'm not sure why that was the case. I mean, I suppose that could have been related, but yeah. So yeah, not something I commonly see. So it is more common with hyperthyroidism. All right, so Judy, I'm still having heart racing 1 to 3 times a week. I found I can take a tiny bit of propranolol when it happens, but I'm now introducing thyroid calming instead. I find that in addition to grave symptoms, I'm gaining weight and sometimes have low energy levels and a bit low oxygen levels using an oximeter. What do you suggest in introducing the herbal, when to take it, and how gradually? PS, still work on triggers. Have many people gotten, okay, yours is pretty long. Have many people gotten Hashimoto symptoms from motherwort, bugleweed, or the thyroid calming combo? So the last question, I mean, there's been some, so with the herbs, first of all, again, motherwort does not really lower the thyroid hormone levels. The bugleweed has antithyroid properties. And yeah, it'll decrease thyroid hormone. It's not as potent as methimazole or other types of antithyroid medication. So, so usually it's not causing, like thyroid hormones to get really low, but there are some situations where it might put someone a little bit on the lower end, especially if they're still taking antithyroid medication. So if they're taking antithyroid medication and the bugleweed, but I wouldn't expect it to cause like really severe hypothyroidism, and antithyroid medication definitely could do that. So, so let's see. Yeah, so when recommending the herbs, like something, let's say like thyroid calming formula, I would take it, between, I would take it like usually before meals, like let's say, thyroid calming is, it's lower potency. So probably something that I would usually recommend like 3 times a day, like, let's say breakfast, lunch, dinner, like 15-20 minutes before that, for example. And, I wouldn't, I mean, gradually it really depends on the person's number. So if someone's, like overtly hyper, I have no problem like putting someone on like the dose like right away, like full dose. It's not like I'll like gradually just, like put them on like a half teaspoon and just gradually increase. So I like to go by numbers. I like to look at the test and see, what the, yeah, it just makes me wonder. Well, never mind. I was gonna say, so you're, yeah, it's not that you're right now Hashi's. You're just concerned about it because causing Hashi's, because I mentioned before Hashi toxicosis, but yeah. So and again, also keep in mind, if the propranolol, again, the herbal equivalent to propranolol would be motherwort. Now it's not this; it's an herb, so it's not exactly the same, of course, not as potent. But if someone's looking for a natural alternative for propranolol, I would recommend the motherwort, not necessarily the bugleweed. Again, the bugleweed is more based on the testing, looking at the thyroid hormone levels. So I rarely do I recommend bugleweed without seeing, I mean, almost never do I recommend bugleweed without seeing a thyroid panel. Whereas like motherwort, I usually I don't have a problem recommending motherwort or hawthorn, um, to a patient who's, like looking for a substitute for a beta blocker. Okay, so Rosetta, how can I improve my mood and energy besides caffeine? So a few different things. One, adrenals. So, work on improving your adrenal health. Try to do as much as you can through diet, lifestyle, stress management, getting proper sleep. Um, some people do need to take, herbs though to help in that area. So things like GABA, things like L-theanine is what sometimes I recommend. And again, I'm not specifically saying this is what you should take, just because everybody's different, and I make more general recommendations here, just saying, like kind of give examples of what I would do with a patient, but I'd hate to just randomly say without have any health history that you should do this, and then, you have a negative reaction. But like for a patient who had that question, and again, I wouldn't necessarily put them on L-theanine or GABA, but I might. But I definitely would incorporate the basics: diet, stress management, getting proper sleep. Gut is very important when it comes to mood. And then thyroid also, we can't ignore thyroid. So if thyroid hormone levels are too high, too low, that could play a role. But gut, if you have a lot of imbalances in the gut microbiome, that could cause anxiety, that could cause depression. So just some people can benefit, for example, from a comprehensive stool panel. Some people might do fine just taking prebiotics, probiotics, nutrient deficiencies as well. Those also could, just, the B vitamins, magnesium, and there's others as well. But I mean, really all nutrients. I hate just like saying, this, these nutrients and, ignore the other ones. All right. So, hi, my name is Zora. First time in this group. Okay, had Graves' disease in remission, but TPO antibodies are very high. I don't know what my triggers were. I'd love to find out. Please let me know what blood I need to take. Yeah, so I mentioned earlier the ones, the basics. And then, if you wanted to go deeper, again, you could look at some of the, viruses. But then, I also mentioned saliva test or adrenal testing. Like I did saliva testing, but for some patients, I'll do dried urine testing, to look at circadian rhythm of cortisol, but also look at sex hormones and estrogen metabolism. So again, most of my patients, besides the blood test I mentioned earlier, I'll do adrenal testing, I'll do hair mineral analysis. It's not a perfect test, but it all comes down to an interpretation. And then sometimes I'll do a comprehensive stool panel or a different type of test. All right, so looks like we have Jeff here. So I was diagnosed with Hashimoto's approximately 10 years ago, but last week I was diagnosed with Graves' disease. What are typical reasons from going to Hashimoto's to Graves? So let me answer that question first. I know you have a few here. So you you might have had antibodies for Graves for a while. I mean, but another thing is there's different triggers for different autoimmune conditions. So, even though, there's a lot of overlap with different autoimmune conditions, not every trigger, like again, stress seems to be a trigger, for different autoimmune conditions, but more so for Graves and Hashimoto's, and then, infections, again, Hashimoto's and Graves, both H. pylori, but honestly, in the literature, it seems like a little bit more lean towards Graves. And then I mentioned with the parasites, even though I've seen both Graves, Hashimoto's with parasites and getting in remission when getting rid of parasites in the literature, blastocystis more associated with Hashimoto's. But yeah, to answer the question, you probably were exposed to, some trigger, even before 10 years ago, because even though you were diagnosed with Hashimoto's 10 years ago, you probably had the antibodies developing like 5, 10, maybe even 15 years prior to that. And then Graves, if you're just diagnosed, there's what's called the silent autoimmune stage. Hashimoto's, again, that could last 5 to 15 years. Graves, the symptoms are usually more overt, like Hashimoto's, like fatigue and weight gain. A lot of people, even when they get those symptoms, they'll relate it to something else, like, oh, I'm just not eating well and, just needs exercise more and, just other things. But when someone starts getting increased resting heart rate and palpitations, they'll pay attention to those in most cases sooner. So yeah, point is, like, maybe a few years ago or maybe a few months ago even, you were exposed to another, like a different type of trigger that, was a factor in causing the Graves. And that's when dealing with one autoimmune condition, most people, well, I won't say most people won't necessarily develop another autoimmune condition, but people are more susceptible to developing other autoimmune conditions. So, there might be someone now with Hashimoto's or Graves, and maybe a few years from now, they'll develop rheumatoid arthritis. There'll be a different trigger that develops that. And that's why you want to try to do everything you can to improve the health of the gut and immune system. Even if someone receives radioactive iodine, like someone mentioned earlier, it's still, that person, if they had Graves, still might be at risk of developing another autoimmune condition. Oh, and then let's see. So in addition, my heart palpitations are pretty extreme with Graves, and my endocrinologist prescribed Propanol. However, I've been reluctant to take it since I have such low blood pressure. Are there any herbals that address heart palpitations without any blood pressure side effects? So yeah, so out of usually I recommend either motherwort or hawthorn. So hawthorn is more likely to affect blood pressure. I can't say that motherwort absolutely won't, but also keep in mind that not everybody needs to take a beta blocker. So even though you're experiencing extreme palpitations, but that the lowering the thyroid hormone levels may also greatly help. When I dealt with Graves, I took bugleweed, and I did not take motherwort. I took bugleweed, and it helped with the palpitations and the resting heart rate. It just didn't completely help. So then I added the motherwort. So assuming, whatever you're taking for the Graves, whether it's antithyroid medication or bugleweed, if you're taking that and if it's still not helping with the palpitations, then, like, again, if you are a patient of mine, I probably would say, take motherwort, and then still monitor your blood pressure. But either way, it's definitely not as potent as a beta blocker such as propranolol, and usually doesn't cause any dramatic decreases in motherwort. But again, everyone is different, so definitely would continue to monitor that. Melanie says, thanks for answering my question. You are very welcome. Okay, so, and I'm going to try to get to everybody at least once. I'm going to go until about 2:15. So let me just see if there's anybody else that, I'll get back to questions if this happened actually Wednesday where I skipped over people, and I was able to get to everyone, I think pretty much everybody, but then the week before I wasn't able to get to everybody. But if I don't get to your question, just make sure you participate in the challenge, and definitely, but next Friday, the Q&A portion. Again, during the week, kind of like today. I can't guarantee I'll get to all questions, especially Monday. Probably is going to be a crazy day because it's the first day of the challenge. So probably will be the busiest as far as people on the call. And I also have patients that afternoon. So I can't, I won't be able to stay on for like 2 hours. But again, I'll be on every day. And then that Friday, I'm going to have two 90-minute sessions. So that's essentially 3 hours. And if the best thing to do is also get on, quick class. So if you live, let's say, in Europe, and you can only attend the day sessions, or vice versa, where you're in Australia and you can only attend the evening sessions. I mean, either way, just try to get on early and ask your question. The earlier you ask your question, the more likely to be answered. All right. So that being said, Christina says, hello, Dr. Osansky. I was diagnosed with Graves in January and have been on an AIP diet and buckwheat, motherwort, and lemon balm, as well as various supplements prescribed to me by my functional medicine doctor. I felt much better after 2 months, but now I feel horrible again. Can't sleep and heart rate is super fast all the time. Is there anything else I can do to help the really fast heartbeat? And why do you think I went backwards in my healing? I'm super confused. So, I mean, just remember what I discussed here. So food is one trigger, and it's important for everyone to eat an anti-inflammatory diet. I do commonly recommend AIP. It doesn't mean everybody has to follow AIP, but either way, you want to eat whole foods and anti-inflammatory diet. And assuming you're still following a similar diet and you are feeling good for a couple of months, but there's obviously things missing. So that's where maybe doing the testing. You're working with a functional medicine doctor, so hopefully most functional medicine practitioners will do more than just diet. That's a great starting point. But if diet is not helping, or if you're in like a similar situation like you, where you're feeling good but then feel bad again, then obviously if someone's already following a healthy diet, then you want to look into other things like adrenals and look into nutrient deficiencies, maybe, do some testing with the gut. It really depends. And then, yeah, as far as sleep and heart rate, and I'm sure the heart rate's not helping with the sleeping. So I'm not sure if you're doing anything, so my patients, let's see. So buckwheat, motherwort, lemon balm. Yeah. So again, that's what I would recommend to patients. Usually I recommend like a 1 to 2 extract of buckwheat. So buckwheats, like if someone takes like herb farm buckwheat, it's a good quality but low potency. If you're taking something like MediHerb, then that's pretty good. And that's like you'd want, like I commonly recommend like maybe a teaspoon, like 2 to 3 times per day. Same with the motherwort. Depends on the symptoms though. Some people, like if someone's real severe, and it depends on the numbers. Like I said, buckwheat, it's more dependent on the numbers. In some cases, I might only recommend half a teaspoon, like maybe twice per day. So, and again, not everybody needs motherwort, but so I guess my point is you want to look at the quality and dosing, like I can't, again, I don't know how much you're taking, but even if I knew, I don't know what your blood tests look like. So that's like where you and your functional medicine will want to work together, but, and make that decision. And then I will say some people do need to take the medication. When I dealt with Graves, I took buckwheat and motherwort. I did not take any anti-thyroid medication, but if I absolutely had to, I would have, back then. So if sometimes there's a dilemma where someone can't take the medication because a lot of people do have negative effects, negative reactions to the anti-thyroid medication, such as methimazole. If that's the case, some people will have a negative reaction to another anti-thyroid med, such as PTU, but not everyone. So that's that's definitely an option to consider. As well as is taking a beta blocker. Again, nobody really wants to do these things, but everything's risk versus benefit. So some people don't like me bring up the medicine option, and I'm going to be talking a little bit about this Monday in the first lesson. It's not going to focus on taking medication, but I want people with both hyper and hypo to be safe while trying to address the cause of the problem. But it's even more important, more of concern with people with hyperthyroidism and Graves' disease. So yeah, make sure you, again, sign up for the challenge if you haven't done so. And, definitely lesson one. I mean, all the lessons are important. Lesson one, lesson two, two extremely important lessons. But Yeah, because lesson two, I talk about thyroid healing roadblocks, where hitting a roadblock and why someone's not progressing, for example. And then again, you want to be safe. So L-carnitine, sometimes L-carnitine, the literature shows 2 to 4,000 milligrams per day has antithyroid properties. And if someone can't take the meds, let's say if they react to all types of antithyroid medication, and if um, the herbs just aren't potent enough, and I'll look into other things, which again I talk about on Monday during a lesson. But so LDN, low dose naltrexone, cholestyramine. Again, I'm not going to get into those here. Definitely, like tune in to the very first lesson of the challenge. Okay, so Marcy, I've not answered your question, and yeah, sorry if my voice is at least to me, it feels like a little bit scratchy. I would definitely be sipping on water if I didn't leave it at home. um, but I should be good for another 15 minutes or so, 15, 16 minutes. So Marcy's question is, hi, Dr. Osansky, I'm having a flare-up of TED, which is, again, thyroid eye disease, which started a couple of months after completing Tepeza infusion. That's interesting. So my TSI number also went up after steadily going down. The eye specialist says the TSI number doesn't necessarily correlate with the physical manifestation. What is your take on this? So, yeah, I've only had a couple of patients on Tepeza. One person went through everything. So Tepeza, for those who are unfamiliar, that's what those with thyroid eye disease. It just came out in early 2020 and involves, I believe, 8 infusions, I think, over every 3 weeks. And I don't know if you caught, I had an interview with Dr. Ronnie Bannock. We spoke about thyroid eye disease, but I also wrote an article on the so I've been saying Tepeza. She pronounces it Tepeza. I don't know if it's Tepeza, Tepeza, but either way. So the infusions. So again, one of my patients went through the entire infusions, and then what was I going to say? So I went through the infusions, and then he it did not help with the double vision, but helps with the bulging. And then I had someone else who had it interrupted, unfortunately, with the COVID situation. So yeah, this is the first situation where I heard of someone getting the Tepeza and then having a flare up, which, I mean, that is in the article I wrote about it, I mean, it's something some people should maybe consider, but it's not addressing the cause of the problem. So that's the downside, is that I'm sure a lot of people will just get the Tepeza and that's it. Just like a lot of people take antithyroid medication and that's it. They don't do anything else and they end up relapsing. So it's a good, I was going to say good lesson learned just in general. I wasn't saying, just obviously one that you or nobody else who gets it wants to, learn that lesson, but it's still, like there's going to be other medications, other things that come out in the future. And, none of these medications really, nothing that I know of is, and chances are nothing is going to address the cause of the problem. Doesn't mean there's not a time and place for it. So I would still, so if you didn't, so I don't know, maybe you did do things to improve your health, like diet, lifestyle, but again, you might need to dig deeper and definitely sign up for the challenge if you haven't done so. But yeah, I kind of disagree with the latter statement, which, the eye specialist says the TSI doesn't necessarily correlate with the physical manifestation. I mean, that is to some extent true, but I will say usually the higher the TSI, the more likely a person is to have thyroid eye disease. I will say that. And I did mention that. I'm pretty sure I mentioned it during the interview when I interviewed Dr. Bannock, who's a board certified ophthalmologist and also has seen a lot of patients with thyroid eye disease. And you might want to also visit my website, naturalendocrinesolutions.com. Yeah, well, you don't have to do that, but I was going to say we're having a masterclass later in June for thyroid eye disease. Really, it's her masterclass. I'm a participant, but it's really her masterclass. But yeah, the higher the TSI, I would say in most cases, the person is more severe. There are exceptions. with that. I will say it's not always the case with other antibodies like TPO and antithyroglobulin antibodies. Like if it's higher, it doesn't always mean more severe. But with CSI, it does seem like that is the case many times. All right, so all right, so just a few thank yous. Thank you, Dr. Osansky, for taking time out of these sessions, and thank you for answering my questions. You are very kind. Yeah, you are welcome. Thank you for attending. Christina, thank you so much, Dr. Osansky, very kind for you to take the time to answer our questions. I really appreciate it. You're welcome. So let me go back because it looks like I'm caught up for now, at least, well, not caught up, but at least I've gotten to everybody at least one time. So I'll go like another 10 minutes. And again, if I don't get to your question, again, I think I got to everybody at least one. So let me just double check with YouTube. I just feel bad, but yeah, it looks like YouTube is, I assume people probably have given up by now. Yeah, and I might have done something wrong too. It might have been the Zoom thing, but I might have also done something wrong just because I was kind of rushing. But let's, all right, so we have Oriana. I'm also having a lot of difficulty. I'm having a lot of difficulty with sleep and also have insomnia. I haven't slept for 1 month now, and my hyperthyroidism is back. I was in remission a few months ago. What can you prevent to help with sleep? So in a similar situation with a patient, I would say definitely want to lower the thyroid hormone levels because that could be a factor with insomnia. Diet is important. Just blood sugar imbalances can cause sleep issues. I mean, some people could benefit from taking like melatonin, but that's usually not the magic solution. There's usually not a magic solution. That's the thing. I mean, there are some people that'll take, again, GABA, melatonin, ashwagandha, valerian. There's a lot of different things that people can take, and sometimes I recommend, but adrenals could be a bit. I wish I could say there's just one thing to take this, but again, there's I would again visit my website naturalendocrinesolutions.com. I've written some articles on insomnia, so you could just do a search and should easily find it. But definitely lower thyroid hormone levels, eat well, and make sure so low carbohydrate, low sugar is what I usually recommend, and then to stop eating at least 2 to 3 hours before going to bed. Try not to be on electronics like we are now before going to bed, which I'll be doing during the challenge. So I won't be practicing what I preach on, Tuesday, Thursday, and Friday. I'll be having evening sessions. So, but try not to do that right before going to bed. And then again, you might need to do testing to look at adrenals, do a salivary testing or, dried urine testing. The Dutch test not only looks at circadian rhythm of cortisol, but also does look at melatonin and also hormones. Like if progesterone is real low, that can cause insomnia. Magnesium. So that's something easy that a lot of times I'll recommend. Well, why don't you try to take like 200 or 400 milligrams of magnesium before going to bed, see if that helps. So there's a lot of things to try, but again, it really comes down to trying to address the cause of the sleep issue, which sometimes you could get you could do that just by changing diet and lifestyle. Sometimes you need to do testing and look at it, see if there's a problem with adrenals or something else going on. So Judy, are there any homeopathic preparations that people are using with success for Graves? I do use some homeopathy for like infections, for example, and for detox, but I don't know of any like for, like the equivalent of like bugleweed or motherwort, like for example, to help, lower the thyroid hormone levels. So yeah, that I'm not sure. I'm not saying there's not something out there. I'm just not aware of what's out there. All right, so Melanie did add also, which I mentioned earlier, motherwort is a great natural beta blocker, which helps with heart palpitation. So thanks for that, Melanie. All right, and then, so I think this is a private message. So, which I guess Zoom changed it. It used to be like a private message, but now it says direct message, but I don't think anybody else could see this. I won't mention the person's name, but I will read this question here. Okay, we got the COVID question here, the vaccine question. So, all right, I'm not going to spend too much time on this. I'm sure it's going to come up during the challenge show, but I know this might be a controversial question. My 14-year-old daughter was recently diagnosed with Graves. She takes methimazole and started a gluten-free diet. What is your personal take on kids with Graves and the Pfizer COVID vaccine? Or I guess you could just say COVID vaccine in general. Yeah, I don't know. I mean, yeah, I mean, it's definitely one of the gray areas when it comes to, I mean, and just in general, it's one of the, because you got, I mean, so, uh, I will say this. So, I mean, it definitely, the vaccine it gives an immune response. I mean, that's what it's supposed to do. And I've seen the immune response in patients because I've seen, I had a patient last week that had a complete blood count with differential, and the neutrophils, neutrophils had a dominant white blood cell count, and that was very high in this person. I'm like, did you just get the vaccine? I usually don't ask that question, but I just asked it just because and I've been working with the patient for a while. It wasn't like the very first consultation, even though I might have still asked the question, and sure enough, so it does, definitely does work, like it does, like affect the immune system. And there are, I can't say it's completely risk-free as far as being a factor with autoimmunity. Now, I did have another patient who, and it was another patient, a different patient, but again, it was this past week, who got the vaccine and said for 2 weeks, she felt like, kind of like she was taking some steps backwards, what she, Graves' disease patient. But after that, she felt back to normal. So again, is it permanence, like, and everybody's different too. So, but I had someone also, this was a few months ago when people first started getting, and this was the Moderna vaccine, where also like 10 days later the person got the or 10 days after the vaccine, and I think it was the second dose of the vaccine, she started feeling like she was relapsing. But and again, it's hard to say, is it due to the vaccine? But then I just heard a immunologist was talking about it and saying the immune response will be greater, not right after getting it, but it will take like I think she said like a week or so after. So that, now thinking about that, makes sense with children. Again, so children, it's not, doesn't seem as likely, of, not that they can't get COVID, but as far as like dying from COVID, again, there's always going to be exceptions, but the greater concern is those with comorbidities and elderly patients. So I don't know. Like I said, so I will say this: I have a 16-year-old daughter, a 14-year-old daughter, and neither of them are vaccinated as of now. And right now, it's not on my radar. Like, it's not like, okay, we got to, my goal is not, in the near future to get them vaccinated. So, and again, we're not talking about, and they don't have a history of autoimmunity. So this is really different situation. So there's, my point is also with adults, there's controversy, but with children, again, just, yeah, again, I'm not saying that there's no concern or that there's no risk. And in your case with your 14-year-old daughter, again, you got to look at the risk versus benefits. She has Graves. Could it potentially make things worse? Maybe not. Again, the only way to know is, to have her, get the vaccine and see. But then again, there's risk to that. And yeah, is there a risk for her not getting the vaccine and getting COVID and something bad happening? Yeah, there is. Again, like I said, there's a risk with my daughters too. But I'm choosing, in this situation, not to have them get the, and I think it was just approved in, I think, 12 to 15-year-olds. So it's a question that I know now, like a few weeks ago or a month ago, wasn't really a question. It wasn't something you could get anything done about. But anyway, so yeah, I understand a lot of questions with COVID, even though this was the first one, and there was none the other day. So, but yeah, there's, yeah, like I said, there's, Yeah. Yeah, it's one of those things with it's like a no-win situation with with giving a response to the vaccine. So, just but yeah, as far as autoimmunity goes, like I said, there's still, we don't know everything, and I'm hoping also, other thing I'll say is I hope to, I will not only hope, and I'm sure I'll get answers as, this year goes by. I'll see more patients get the vaccine. Again, I'm not telling patients to get it or not to get it, so that's really up to them. But, regardless of what I say, people are going to get it. And if we see like cases where, if it's like a week or two and it seems temporary, that's one thing. But if we see like auto antibodies increasing and staying increased after getting COVID, then that might be a problem. But I know there's been people who have got COVID where that hasn't happened. So, but a very small sample size. So, all right. So Jenny here. Okay, I'm going to make this, I think, the last question, because I think I got to pretty much everybody's question. Um, so this will be my last question, and then it's 2:14. I said I would end it at like 2:15. So very good timing. And Janita says, awesome. Thank you so much. You're very welcome. Um, all right. So Jenny, can sudden sensorineural hearing loss be connected to Graves' disease? I had Graves' disease, then went to remission. My hearing loss was after Graves' disease. Yeah, I mean, yeah, I can't say I've seen, like, I experienced tinnitus, and I've had other patients, like ringing in the ears with Graves. So it's not like there's not a connection. I can't say that I've seen, like, again, I don't recall. I'm trying to think of any cases of sensorineural hearing loss in my Graves patients. And I've, again, been doing this for now over 10 years, just what hyperthyroidism, hypothyroidism, a lot of people with Graves. But again, I've seen a decent number of, tinnitus cases, and included myself, which thankfully after a few months went away. Um, yeah, so you said my hearing loss was after Graves' disease. So yeah, I'm honestly not sure, Jenny. It might be related. And again, keep in mind remission, like some people consider remission. Okay, I went on the methimazole or whatever antithyroid medication someone went on for whatever period of time, 12 months, 18 months, 2 years. And then, everything looked good. So I was able to get off the methimazole. So I don't necessarily consider that true remission, just because the cause of the problem wasn't necessarily addressed, and good chance for someone to relapse. So if that was the case with you, I would still look into, like making sure you're cleaning up your diet and doing, pretty much everything will be talked about in the Accelerated Thyroid Healing Challenge. So again, I would, even though you're in remission, you might want to tune into that. Again, I don't know for sure though. I don't know if anybody could tell you for sure if it's related. It's, yeah, if it is, it's something rare, because again, have not had I don't recall patients having that. You could also, I don't know if you're on Facebook, but one of the advantages of the Facebook group is you could, go in there, and, I have one for Graves and Hashimoto's, which has a little over 4,000 people now. But then I have one that just focuses on hyperthyroidism and has about 1,800 people. So you could also post something like that, I had Graves' disease, when it's remission, then developed sensorineural hearing loss. Anybody else experience that? And then, just to see what others say. So that's something, even if you had to create a fake Facebook, a fake Facebook account, just to, post that and see what the response was. And speaking of which, some people do that. As far as the challenge goes, the challenges, there are some people that, again, you don't have to be on Facebook, but there are some people that, with my past challenges, they just created a temporary account just to engage with others and to be eligible for the prizes. And then as soon as the challenge is over, they just deleted their Facebook group. So, I'm not a big fan of Facebook. I'm just on it because it's another way to reach people with Graves and Hashimoto's and other thyroid conditions, or, non-autoimmune thyroid conditions. So, but yeah, there's definitely a lot of censorship going on, and, just in a perfect world, I mean, again, I don't have to deal with Facebook at all. But like I said, I do it because some of my audience is on there, and I do like when doing the call, StreamYard is a lot friendlier than Zoom. I could like post the comments and like people could see the comments. Like here, I have to just like read them out, which is not a big deal. But okay, Jenny says thank you so much. All right, well, you are welcome. And all right, well, I am going to go ahead and call it a day. So again, thank you everyone for your questions. And yeah, if you enjoyed this, I would recommend signing up for the challenge if you haven't done so already. Again, rapidthyroidhealing.com. And again, Monday, 12 noon will be the first live call. Again, you don't have to attend the live calls. You could just watch the recorded presentations every day, but the live calls will also be recorded. So if you don't want to catch it live, you could wait for the recording. And that is it. So again, thanks. And again, apologize again for running late. Like I said, just yeah, it's funny. I had the Accelerated Thyroid Healing Challenge last year in last August. So this is the second time I'm running this specific 5-day challenge. And I was looking back at my notes last year. I think it was just saying, I was doing a Q&A like right before the challenge, and ended up losing power. There was a storm and power went out. Like it was I think toward like the Q&A session. So I answered a lot of questions and all because I was looking at the past posts and I saw the post I put like apologizing to everybody. So anyway, so yeah, just so yeah, for second year in a row where something happened, this time the internet going out. But again, thanks for your patience, and again, hope to see some of you, if not many of you, at the upcoming challenge. And again, I hope everyone has a wonderful rest of your Saturday and rest of your weekends, and take care. Thanks again for tuning in, everyone.